Sciatica can be frustrating and persistent, and it can feel like one of those things that you just want to stretch out, but you can't. But luckily, it's one of the most common things that we treat. And with sciatica, it can present with pain, numbness, burning, tingling, or weakness into the hip, down to the knee, or all the way down to the heel. And there can be a few different things that cause sciatica like symptoms. So, whether that's a disc bulge or herniation, spinal stenosis, piriformis syndrome or nerve entrapment, or even local trigger points around the low back and hips can refer pain like sciatica. So that's why it's really important for us to figure out where your symptoms are actually coming from to give you the most effective treatment. In our assessment, we go through all of your joints to see which ones are restricted or not moving enough, but also which ones are hypermobile and maybe moving too much. For sciatica, we love the McKenzie method. So with the McKenzie method, we take your spine through repetitive movements and we see if we can change or centralize your symptoms at all. If we can draw your symptoms out of your leg and move it closer to your spine, that's a good indication that your symptoms are coming from your spine, but also we're going to have successful treatment. And we also do a neurological exam to see if there is any nerve entrapments, and then we palpate the local musculature to see if there's any increased tone, tension, and trigger points that could be contributing to your symptoms. So our assessment will give us a pretty good indication of what's going on and what's actually causing your symptoms. So then we can apply the most effective treatment. So different treatments include chiropractic manipulation to restore motion to those restricted or sticky joints. If the McKenzie method helps centralize your symptoms, that's something we'll use a lot of, and we can actually send you home with that to help speed up your recovery and allow you to take some control over your symptoms. For trigger points, we love dry needling, and we also use some other soft tissue techniques to help relax those tight muscles. And the base of our rehab is dynamic neuromuscular stabilization, which helps create stability and proper movement patterns around your spine, core, and hips, and allows us to address why you developed your sciatica symptoms and provides long-term solutions. You don't have to live with sciatica, and it's generally something that doesn't require surgery. So if you're frustrated and tired of dealing with it, please reach out to us to see how we can help. We want to get you moving and feeling your best.